The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. My name is Hunter Wiles, and I'm a paralegal at Wiles Parker. Thank you for joining us today for a special webinar in addition to our monthly Wednesday webinar series, which is presented by Wiles Parker and sponsored by the Texas Association for Home Care and Hospice. Today's topic is COVID-19 Employee Health Issues for Home Health and Hospice Agencies. Despite the approval, release, and distribution of the coronavirus vaccine, the numbers of available doses are still not sufficient to vaccinate all at-risk populations and individuals. Thus, home health and hospice agencies may find it difficult to make decisions regarding COVID-19 vaccinations. The questions we will cover include whether the state of Texas, the federal government, or a home health agency or hospice may require employees to receive a coronavirus vaccine, what conditions may exempt or excuse an employee from getting a vaccine, what recourse an employer may have if an employee refuses the vaccine, and how you should handle patients who ask if their caregivers are vaccinated. Join attorneys Heidi Kocher and Jennifer Papapanagiotoufor for discussion of the considerations home health agencies and hospices must evaluate in developing their policies. This webinar is scheduled for 60 minutes and a Q&A will follow. Ms. Kocher is a partner with Wiles Parker and has over 20 years of experience in healthcare, legal, and compliance-related issues, representing all kinds of healthcare providers. Her experiences include serving as a chief privacy officer and interim chief compliance officer at a medical device manufacturer. She also served as an outside compliance expert to a hospital and clinical laboratory that were under corporate integrity agreements. She has significant reimbursement experience responding to and defending audits, addressing coverage policy issues, challenging denial recoupments, the loss of billing privileges, obtaining HCPCS codes, and other reimbursement-related issues. Her experiences also include implementing corporate integrity agreements, guiding clients through voluntary self-disclosures, and seeking advisory opinions from OIG. In acknowledgement of her expertise, Ms. Kocher has served as a lecturer in the Biomedical Engineering Department at the University of Texas at Dallas, and she is licensed in Texas and Maryland and certified in healthcare compliance. Our next attorney is Jennifer Papapanagiotoufor. Jennifer focuses her practice on transactional, corporate, regulatory matters for healthcare providers and suppliers, including but not limited to home health and hospice agencies. Her focus is on the types of issues healthcare providers deal with every day, including operation and compliance issues, drafting contracts, including medical directorships, employment agreements, management contracts, buying and selling healthcare provider businesses, advising on compliance with federal and state healthcare fraud and abuse statutes, litigating Medicare and Medicaid provider enrollment and revocation appeals, assisting with state licensing, accreditation and survey matters. In addition to her work in transactional regulatory matters, Jennifer supplies substantive support for in healthcare fraud investigations and litigation. That being said, let us begin this TAC webinar.
Thank you, Hunter. If you would go to the next slide, please. So, of course, being attorneys, Jennifer and I do have to issue this disclaimer that this webinar and information is for general information only. It does not constitute legal advice and should not be used as a substitute for seeking counsel from your attorney. We're attorneys, but we're not your attorneys. And as they always say in the car mileage commercials, your mileage may differ depending on specific facts. Another thing that we wanted to put out here before we plunged into the details is that we have made the assumption and we are placing this webinar in the context of an employer already having a COVID-19 screening program. I mean, we are in month, 9 or 10 of this pandemic now. So we have made the assumption that you all already know some of these basics, such as screening programs, and you have developed policies and procedures for what to do if you have an employee either testing positive for COVID-19 or showing signs and symptoms. So we're not going to address that. This is strictly going to address the fact that now we have vaccines starting to roll out, and what are you going to be able to do as an employer, and what are your considerations in relation to vaccines for COVID-19. Next slide, please. So one of the things that we're going to do is we're going to take some scenarios, because I think it is often very useful to put context on laws and regulations in the context of specific scenarios, which often helps illustrate various points. So the first scenario we're going to start out with is here. So Stella has a home health agency called Personal Care for You. It has 35 people. 10 are full-time nursing, therapy, and other field personnel. 5 full-time office personnel, such as a receptionist and a biller and coder and so on. And the remaining 20 individuals are part-time nursing and therapy personnel. So the county where Personal Care for You is located has been truly overwhelmed by COVID-19 cases, and Stella wants to mandate that all her employees receive the COVID vaccine now that we are starting to get shipments of that. Can she do that? So this is going to be the basic scenario that we are going to work off of and attempt to answer the questions as we go through. Next slide, please. All right, so generally speaking, an employer has the 100% right to set the terms and conditions of a workplace. And that right to set the terms and conditions of a workplace includes setting out expected behaviors and procedures and so on for conducting one's job. And both Texas and federal law permit employers to set the terms and conditions of a workplace. Remember also that Texas is an at-will employment state. So in that context, therefore, generally speaking, an employer may require its employees to be vaccinated. So you home health and hospice agencies out there may require your employees to be vaccinated. However, there are boundaries and limitations to what an employer can require of its employees. And even though we have this sort of underlying assumption that generally speaking you can mandate a vaccine, vaccines, there are so many factors and considerations that go into that that you need to be very, very careful in mandating that your employees get vaccinations. So we're going to plunge a little bit into some of these laws now. Next slide, please. Jennifer, you want to take it over?
Oh, I'd be happy to. As Heidi and I were working on this presentation and talking through what we wanted to cover, we've all sort of come to understand and appreciate the guidance saying employers can mandate vaccination, but we're hoping to give you some context for why mandating that activity may or may not be the best course of action. And it's an individual decision for every employer how they approach this, and it can be geographically specific, it can be very specific to your patient population. There are so many factors that go into it. We just want to give you a flavor for sort of the pros and cons of that kind of policy. So the laws that we worry about, there's a whole laundry list of laws that apply to this type of scenario, and most of them are what we would typically, commonly refer to as civil rights type laws. And they've been, something in some form or fashion has been in place as early as the 60s when the Civil Rights Act was passed that really protected what we call sincerely held religious beliefs, and it applied to employers with 15 or more employees. And as time has gone on, those laws have grown and changed and have been added to. So in 1973, they passed the Rehabilitation Act, which was really our first law that prohibited discrimination on the basis of disability. And it had some shortcomings, and it didn't cover every kind of workplace, but generally the Rehab Act applied to employers with 50 or more employees. Then in 1994, and this was a hot topic when I was in law school in the mid-90s, the Americans with Disabilities Act had just been passed. It was passed in 94. And it expanded the protections for individuals with disabilities, and it also increased the number of employers that were covered. So if you have 15 or more employees, you're required to comply with the Americans with Disabilities Act. And then finally, in 2008, they passed the Genetic Information Non-Discrimination Act, which prohibits discrimination on the basis of genetic information. Again, like the ADA, this applies to employers with 15 or more employees. And there are certainly other laws that can be relevant. It would be impossible for us to cover them all, but these four are sort of the heavy hitters. There are also things like the Age Discrimination and Employment Act and other, in fact, state laws that can affect these things. Hunter, let's go ahead and go to the next slide. So the main agency tasked with enforcing these civil rights laws is the Equal Employment Opportunity Commission. I'm sure you're all familiar with that organization, but essentially they enforce these civil rights laws that make it illegal to discriminate against a job applicant or an employee because of the person's race, color, religion, sex, national origin, age, disability, or genetic information. So all those federal laws we just went through, the EEOC is the primary organization that enforces those laws. And as a general rule, if you have 15 or more employees, you're subject to the enforcement activity of the EEOC. The Occupational Safety and Health Administration obviously is responsible for workplace safety, and they have their own regulations that can become relevant when we start talking about COVID-19 and protection of your workforce. So let's skip to the next page. So dig a little bit deeper into the Americans with Disabilities Act. As I mentioned earlier, it prevents discrimination against individuals with disabilities. It's the broadest law we have that applies to individuals with disabilities. And I wanted to elaborate a little bit on what disability means. And if you've heard this before, apologies in advance, but I thought it would be useful to know exactly what the statute says. So a disability is defined as either a physical or mental impairment that substantially limits one or more major life activities of an individual, or a record of such an impairment, or being regarded as having such an impairment. So you can be protected by this law if you're simply regarded as having an impairment based on appearances or whatever information someone else has gathered about you. It's a very, very broad definition. And just suffice it to say that if you fit into this definition, employers are required to make reasonable accommodations as long as that reasonable accommodation of your disability does not create an undue burden on the employer. There's lots and lots and lots of case laws you might imagine that have looked at what's a reasonable accommodation and what's an undue burden. And there are lots of guidance documents out there, both through EEOC and other organizations like ADA.gov, which is a great resource for information on ADA. There's another one that we're going to talk about a little bit later that is a nonprofit organization that essentially helps employers with accommodation. How do you accommodate people with disabilities? What are sort of tried and true methods or things that might assist an employer with accommodating a person with a disability? Regardless, anytime an employer has an employee with a disability, they have to reasonably accommodate that disability as long as it doesn't create an undue burden. And every single instance requires an individualized determination of what is a reasonable accommodation and whether those accommodations present an undue burden. So one of the challenges in COVID-19 policy and procedure for employers is this individualized determination element. It's really difficult to set baseline policies that you try to apply to everybody because everybody has unique circumstances. And we're going to go through some more details that help you sort of slice and dice how this really applies in practice. But one thing Heidi and I, when we talk about this, that we sort of remind ourselves is every situation is unique, and you can set policies that set general standards that ultimately it comes down to an individual assessment for each employee. And if you're having to determine whether an accommodation is reasonable, it's very, very difficult to sort of make unilateral, broad conclusions about a group of people. It's very important you make individual decisions, and it's very important that you document, and keep records of how you reach your conclusion. So let's go to the next slide. So Title VII is under the Civil Rights Act, and it mainly covers protection against religious discrimination in the context of things like the COVID vaccine. There are certainly religious beliefs out there that don't subscribe or they're people who participate in these religious organizations don't believe in vaccination, and they have protected status under Title VII. That's not to say that it's a get out of jail free card. There are certainly boundaries around that, but generally speaking, Title VII prohibits treating somebody differently because of their religious beliefs. And there are some guidelines there. This protects people who have sincerely held religious, ethical, or moral beliefs. And it also includes treating somebody differently because they're married to or associated with another person of a particular religion. I don't know that that's as relevant to us in the COVID-19 vaccine conversation, but certainly that first bullet, that someone who has sincerely held religious, ethical, or moral beliefs is certainly a category you may encounter as an employer when it comes around that you're interacting with your employees and deciding whether or not to mandate vaccines or offer them to your staff. So let's skip to the next slide. And Heidi, I think you were going to pick up from here.
Yeah, thanks, Jennifer. So now let's dive a little bit more deeply into some of the very specific guidance that has been out there on COVID-19 vaccinations. So one of the things that I'm going to say here is that this, like all of the things that have been happening this year, is again an area where there can be some pretty substantial changes. So it is going to behoove all of us to stay aware of what is happening. And here is a perfect example. So basically, most of the year, the EEOC had just been pointing to its prior guidance on religious discrimination protections, other vaccines, and so on, in the face of questions about what to do about COVID. And it wasn't until we actually had the vaccines approved that EEOC finally issued specific guidance. And they issued that on December 16th. So that was kind of a nice Christmas present for a lot of employers. And so this guidance specifically says that an employer may mandate vaccines. So again, they give cover on that. But again, they explicitly say that this is subject to the requirements of the ADA. Furthermore, the EEOC made clear that you can only mandate a vaccine where an employee poses what is called a direct threat if they're in the workplace and are not immunized. And they defined a direct threat as a significant risk of substantial harm to the health or safety of that individual or others that cannot be eliminated or reduced by a reasonable accommodation. So what this says is, even if you determine that having an unvaccinated individual is a direct threat, you still have to go through a reasonable accommodation analysis if somebody steps forward and says, I don't want to be vaccinated because of a religious belief or a sincerely held ethical objection. If you can't make a reasonable accommodation, then you can exclude the employee from the workplace, but you have to be careful about that as well. You then have to consider what kinds of accommodations you can make. So for example, excluding somebody from the workplace does not necessarily mean terminating them. You have to evaluate if there are other options out there for this employee, such as assignment to another position. Perhaps they work in the office, in a back office, instead of being out in the field. Can they do telework, et cetera, et cetera. And so the analysis that applies here is going to be the same kind of analysis that you probably have engaged in already when you have done your screening for COVID-19 symptoms and encountered an employee who has those symptoms or who has tested positive for COVID or had it. And again, we're not going to go into this, but you need to consider in this context whether other laws might be applicable. So for example, might the employee be eligible for FMLA leave or FFCRA leave, or again, do you have other policies that might address how you handle somebody who may pose a direct threat? Next slide, please. So the EEOC actually put out some factors for what is the individualized assessment of a direct threat. And I'm going to sound a little bit like a broken record here, but as Jennifer said, again, this must be an individualized assessment, and you must document this. You have to have something in your files that says, I evaluated, John on these factors, and I came to this conclusion. Have it written down. This is what will save you if there is an employee objection and the EEOC investigates. So the factors that you need to look at for the individualized assessment of a direct threat are, number one, the duration of the risk. And of course, now we've got COVID-19. Who knows how much longer this pandemic is going on? We've heard people saying, spring, late spring, early summer. I've heard people saying summer. I've heard other people saying, yeah, it's probably going to take us into fall of 2021 before we get sufficient community vaccination and worker vaccination to really make a difference in the pandemic. So that's one of the things you need to evaluate. Number two is the nature and the risk, the severity of the potential harm. So obviously, if somebody gets sick with COVID, it might be just a mild cold, but there is sufficient evidence out there that the potential harm is pretty severe. Death, if you get a bad enough case. And again, you're going to have to evaluate this. The likelihood that the potential harm will occur. So there you're going to have to do things like evaluating what the incidence of COVID is in your community. And you will also have to evaluate, again, the factors of this individual. Is this somebody who is in their 30s, who is extremely healthy? Is this somebody in their 60s and has underlying conditions? Are they obese? Do they have cardiac issues, hypertension, what have you? You have to document these kinds of things. And then the imminence of the potential harm. I think that in these kind of circumstances, we can probably say that the potential harm is pretty high, and that it's pretty imminent of the potential harm. So in any case, you need to include this determination that an unvaccinated individual also can expose others to the virus in the work site. So you can't exclude them from the work site unless there's, again, no way to provide a reasonable accommodation, absent undue hardship, and we'll talk about that in a little bit. But basically, you can't exclude them unless there's no way you can accommodate them in a way that would eliminate or reduce this risk. That's kind of a mouthful, and once we go through some of the scenarios, you can kind of see how that plays out in the analysis. Next slide, please. So reasonable accommodation, both the ADA and Title VII do require employees to make what is called a reasonable accommodation for employees if making the reasonable accommodation does not create what's called an undue burden on the employer. And the key thing here is that the employees must make the exception request. You do not need to offer a reasonable accommodation if the employee does not request it. Now, what does the employee have to do? Well, they have to make the request, number one. And number two, the employer can then request reasonable supporting documentation to support that request for a reasonable accommodation. And this is particularly the case if it is a medically based accommodation. Now, you have to be careful And again, as Jennifer and I have said before, and I'm going to say again, this is an individualized determination. You cannot require the same documentation from everybody because everybody has different circumstances. It might be something as simple as a letter from a doctor. You know, it might be other medical records. I mean, you'll have to make that decision on a case-by-case basis. What kind of documentation is going to be required? And again, what is reasonable is going to vary on a case-by-case basis. I will say that the analysis for reasonable accommodation and the supporting documentation does vary a little bit. It's probably not important for the purposes of our webinar, but do know that it is out there. And again, this is why you need to be working with somebody who understands this if you have this kind of situation. And again, we've said it before, but I'm going to say it again. Employees cannot be automatically excluded from the workplace just because they refuse to be vaccinated. You have to go through the analysis. Next slide, please. Okay, so again, reasonable accommodation under the ADA, an employer must grant the reasonable accommodation unless granting that accommodation creates a significant difficulty or expense. Under Title VII, it's that the accommodation creates an undue hardship, and the definitions vary a little bit. Undue hardship under Title VII is the one that a lot of people seem to have the most difficulty with, and an undue hardship is more than a minimal cost or burden. So again, you need to keep these definitions in the back of your mind as you're going through the analysis. So common examples of accommodations for a religious objection to a vaccine mandate are things like flexible scheduling, job reassignments, and modifications to workplace practices or policies. Again, it's really hard to sort of come up with and say, yes, this will work perfectly in all circumstances, because again, not every individual is the same, and not every employer is the same, and not every workplace is the same. We will note that under both the ADA and the Title VII, this process of determining what is a reasonable accommodation is considered and should be, and the EEOC actually mandates that it's what they call a flexible interactive process. So it's not this rigid thing where you have to tick these boxes. This is where the employee comes to you, makes a request, and you, together with the employee, go back and forth determining and discussing and then determining what is a reasonable accommodation. So that's part of why we keep on saying that this is an individualized process and why your documentation is so important. Next slide, please. Okay, so here are some of the factors that you should be considering in evaluating an accommodation request. And again, think back to the definition that Jennifer had given of what is a disability under the ADA. So one of the first questions is going to be, what is the employee's limitation? You know, what is the limitation? And again, it could be things like you know, a particular underlying disease condition. What is it? You want to be relatively specific. You don't just want to say underlying condition, but you want to be a little bit more specific about what it is. And then once you get to that point, then you only need to, as an employer, provide a reasonable accommodation to permit the employee to perform a specific job. Sometimes what happens is employees come and they say, I need an accommodation under the ADA and I want to do X. You know, let's just say I want to work from home, is the accommodation request. Well, the employer doesn't need to grant necessarily the specific request, I want to work from home. You know, you can work with them and you can do a request that permits them to do the job. So instead of working from home, you might instead say, well, you know, I need you here in the office because and then you can say why. But I understand your concerns, and so we're going to put you in sort of an office at the very back of the office suite, and we'll give you extra PPE, something like that. Or maybe you do something like, okay, how about we schedule your hours from, 6 a.m. to noon so that you can come in before everybody else comes back in for the day, thereby minimizing your contact with other employees. So that's one of the things that you can do. Another factor to consider, again, is what is the employee's job? And again, how might the job affect the accommodations? And how would the accommodations, conversely, also affect the job? So again, in this example, perhaps the job could be done remotely and safely and appropriately. And then the third factor is, will the accommodation pose safety risks to the employees or others? So again, these are some of the factors that you're going to use evaluating a reasonable accommodation under the ADA. Next slide. Under Title VII, it is pretty similar. Again, limitation. Again, you can ask for some information on the religious beliefs. You need to see what the job is, and again, how does the accommodation request affect the job? Next slide, please. So just for context, and again, vaccinations and mandatory vaccination is not a new issue, so it is sometimes useful to see what the EEOC has done in relation to other vaccines. And one of the most common areas where employers mandate a vaccine is in relation to influenza. And so a lot of people look to mandatory influenza vaccination programs for guidance on how a COVID-19 vaccine might be handled. And just in relation to the influenza vaccine, the EEOC again has suggested that employers should strongly encourage vaccination but require it. Again, part of the problem is this reasonable accommodation issue. It is very easy to trip up on a reasonable accommodation if you have a mandatory vaccination policy. In relation to most other vaccines, the EEOC will look to what the CDC's guidance is on vaccine recommendations, and then they will look to state laws. So I just put up here the guidance for healthcare providers on vaccines. It's something you can look at your leisure later on. Next slide, please.
All right, this is Jennifer again. So Heidi kind of talked about the federal law and the status of things, and we've certainly seen and had a number of questions from folks about what does the state of Texas, what's their position on COVID vaccine for healthcare providers and others in this particular industry. And HHAC has stated in writing in some FAQs that are available at the website noted here that it does not have the authority to require home health or hospice employees to be vaccinated against COVID. So there is no governmental mandate for vaccination. It's left up to each individual employer to set their own policy. I just want to be very clear about that. It's nobody at the state level has said you must vaccinate. So the next slide. So we wanted to sort of give you some points to consider. There are risks and benefits of implementing a mandatory vaccine policy. And I've got a couple slides discussing risks, and then I've got a slide discussing benefits. I mean, it's important to think through whether mandatory vaccination is the right decision for your organization. So what are the risks of doing this? Well, one is you will undoubtedly get requests for accommodation. There will be employees who articulate either a religious objection or articulate a potential disability issue. Let's just say someone is perhaps allergic to ingredients in the vaccine, and that prevents them from being able to take it. Or you have an employee that their religious beliefs don't allow them to have vaccines. You will get these. If you do, you're going to have to go through the process of that individualized assessment of whether or not they pose a direct threat. And if they do, you have to make reasonable accommodation. So denying an accommodation request can lead to a claim for failure to accommodate. So if you implement mandatory vaccination for your employees after doing the direct threat analysis, you're going to have to do individualized assessments. And if you end up denying accommodation requests, it can lead to compliance issues and investigations by EEOC. That can be expensive. It's certainly not something anybody wants to do, especially when you've already got your hands full just responding to the day-to-day demands of your business during the COVID pandemic. But it's something to keep in mind. Second risk we outlined here is you're open to discrimination claims, as so much of this decision about whether to accommodate is individual analysis. And, you know, reasonable minds may differ. Sometimes employees expect you to provide the specific accommodations they want. And as an employer, you are not required to provide the specific accommodation they want. You are expected to be reasonable and work with the employee, and you better be able to articulate why you could provide an accommodation. If you make a decision to exploit an employee from the workplace, then you need to have really good documentation of your individual specific analysis and why you went down that road. Terminating an employee for failure to vaccinate could result in a state law claim for wrongful termination. That can either run through the Texas Workforce Commission when they're seeking unemployment insurance benefits, or it could result in civil litigation. So it's something to keep in mind as a risk of implementing a mandatory vaccination program. Next slide, please. There will certainly be additional administrative expense if you implement mandatory vaccination. Employers will have to be conducting these individualized assessments that we've talked about, documenting those assessments, ensuring comparable treatment for comparable employees, and tracking compliance with the mandate. So if you implement a policy like this that requires mandatory vaccination of some or all of your employees, you're going to have to create all the administrative things that go along with that. Also, the latest stimulus bill passed at the federal level does not contain liability protections for employers for mandatory COVID vaccines. So presumably any injuries that an employee may have suffered as a result of receiving a vaccine would be covered by your state workers' comp laws, presumably, but we really have no track record with that. And also, presumably, the PrEP Act may also offer some liability protection for employers, but again, this is going to be an employer by employer specific analysis. And I would say there's a lot of debate out there right now about the how all-encompassing the protections in the PrEP Act really are. There's been a lot of press and other things going on about the liability protections under PrEP, and so I would say there's going to be a lot of litigation about that in the coming months and years. Let's go to the next slide. So what are the pros, obviously, for implementing mandatory vaccination? And again, a mandatory vaccination policy doesn't have to cover all of your employees, and it probably shouldn't cover all of your employees. I think most people are focused on their clinical staff that interact with patients and whether to impose mandatory vaccination for those people who are sort of the patient-facing, who have interaction with patients on a day-to-day basis. So what are the potential benefits? Well, mandatory vaccination may increase employee participation, making the care provided in the workplace safer for everybody and potentially ending the pandemic sooner. You know, everybody's entitled to their positions and beliefs about whether, you know, COVID's real or not and whether vaccination is effective or not. If you implement mandatory vaccination for all or some of your staff, I think the science is out there that it should be beneficial to everybody involved, but it comes with a whole heap and help of administrative stuff you're going to have to deal with and could create conflict in your organization. So it's just something to keep in mind. It could result in less time off or sick time being taken because you'll have fewer infected employees, presumably. It could have marketing or PR value in relation to patients and referral sources. If you get 100% compliance among your clinical staff, that may be, you know, something you can use to your advantage in your marketing efforts. And it could help your agency avoid a claim that you failed to provide a safe workplace. So there are certainly benefits for implementing mandatory vaccination. Keep in mind, you can strongly encourage COVID vaccination without mandating it and probably achieve many of these benefits. So that's, I want everybody to be aware of that you can stop short of mandating vaccination and still achieve a lot of these benefits. So let's go to the next slide, please. So let's revisit the very first scenario we talked about. And I want to go back and sort of reread. If we can go to the next slide, please. We originally, Heidi described a scenario where there's a home health agency with 35 staff members, 10 full-time nursing therapy and field personnel, 5 office personnel, and 20 employees who are part-time nursing and therapy personnel. And it's located in a county that's been overwhelmed by COVID cases, and the owner wants to mandate that all employees receive the COVID vaccine. Can she do that? Under the current law and the interpretation of it, yes, she could mandate vaccination. You would have to do that in the context of having gone through the analysis we've discussed here. So you've got 35 employees total of this agency. So the Americans with Disabilities Act and Title VII are going to apply. And so you're going to have to do that direct threat analysis. And for those staff members who fall into that category where there is a direct threat either to them or to others in the work environment, and that could include other, fellow workers, or it could include patients that they interact with on a day-to-day basis. You've got to do that direct threat analysis. You've got to document it. And then if there's a disability or a religious objection, you've got to provide reasonable accommodation and go through that whole analysis. So if an employee were to request an accommodation, you're going to have to go through this individualized assessment and document it and see, justify that the vaccine is something that's job related, it is to mitigate a direct threat. And if the employee were to object to it, you've got to go through the reasonable accommodation analysis and defend whether not providing an accommodation, if you make that decision, is because there's an undue burden on the agency. So this is just sort of to elucidate. It's very simple to say, I'm going to mandate vaccination for my clinical staff, right? Or I'm going to mandate vaccination for 100% for everybody at the agency. You're making, you're bringing in a whole host of administrative things you're going to have to do to implement that policy. So it's just something you should be aware of. You can do it, but it comes with a lot of additional documentation and work. So let's go to the next slide. This is, I think we skipped a slide. Did we? No. Heidi, I think you were going to pick up from here. Yep, we're good.
Yep.
Go ahead.
Yep. So let's just kind of evaluate another scenario again, because again, I think it's sometimes helpful to see how these principles apply once you have some specific fact scenarios. So one of the agency's employees, Elizabeth, is an intake coordinator. And again, we are assuming here that the agency has mandated a vaccine for all employees. She's objecting to the vaccine requirement, stating that she's allergic to the ingredients in many vaccinations, and she requests to work from home as a reasonable accommodation instead of getting vaccinated. So what are the agency's responses, and what should you do to respond? Next slide, please. So again, when you get this, as Jennifer said, you're going to have to evaluate what is the nature of her job. She's an intake coordinator. So you need to evaluate what it is she is doing and who she is interacting with routinely, and whether or not this is an essential part of her job. And as part of this, you need to look at, are these functions something that can be performed from home? The other thing that you can do is you can ask for documentation of her allergies to vaccines. And again, there's no specific documentation that you require. A letter from her physician should be sufficient for this kind of thing. And as an aside here, you want to make sure that you keep this information secure, because we also have privacy issues. You don't want a HIPAA concern. and there are privacy concerns under EEOC as well. So just make sure you keep your documentation. You don't want to broadly state that, oh yes, Elizabeth is allergic to vaccines. Can you imagine that? And have that spread throughout your workforce. So the next step then is to evaluate whether having Elizabeth work from home creates an undue burden on the agency. And again, this is a very specific to your particular agency step that needs to be done. You know, how many people, how many hours, you know, what is the workload, what are the specific tasks? If there is a reason that she needs to be in the office, you need to say why that is and how having her out of the office creates that undue burden. And then you need to evaluate and again document that is there some other way to accommodate her request to be exempt from vaccines. So for example, what if you did a schedule shift so that she only works in the mornings or she works in an isolated office? There may be other ways to accommodate her request to be exempt from the vaccine. And again, remember what we said is just because the employee requests it doesn't mean you have to grant that specific request. You have to grant a reasonable request, but you don't have to grant this specific request. So she may want to work from home, but you may find there is some kind of way that better addresses her request for an exemption and does not create an undue burden on the agency. And again, you want all of this documented. Next slide, please. Jennifer, you want to take this scenario?
Sorry, I muted myself. So we need to cover a scenario where there's a religious objection. So let's look at this scenario 3. So one of the registered nurses objects to the vaccine requirement, stating her religion prohibits vaccination. Her supervisor doesn't believe that Maria's religion really prohibits vaccination, or she doesn't believe that it is what we call a sincerely held religious belief. The supervisor has never heard Maria talk about her religious beliefs and thinks she's just objecting because the vaccine's approval was rushed through the FDA. What should the agency's response be, and what steps should the agency take to respond? Let's go to the next slide. Much like you would for a disability, a religious objection requires the same sort of analysis. The agency should have evaluate or should have already evaluated the nature of Maria's job. Is a vaccine a job-related requirement? Well, she's an RN, so arguably if she's out in the community seeing patients of a home health or hospice agency who by their very nature tend to be people who are very susceptible to COVID and who could have significant health effects as a result of having COVID. So I think arguably a vaccine is job related for someone in her position. The next thing you would consider is whether there is truly an objective basis for believing that Maria, the nurse, does not have a sincerely held religious belief. You're questioning whether her religious belief is really, truly real. The supervisor can ask for additional information about her religious beliefs, such as written materials about her faith practices or a statement from a faith leader. But you have to be very, very careful about that. You should not request excessive documentation, make her sign any sort of unreasonable statements about her religious beliefs. This should be you want something evidencing that this is a real thing, but you're not looking for an affidavit for Maria that she's whatever her faith is requires this. Be reasonable. Don't go overboard with your request for documentation on a sincerely held religious belief. You can ask for something, but be reasonable about it. If you request excessive documentation, it could be viewed as denying a reasonable accommodation, retaliating or harassing the employee, and that's just going to lead to investigations and potentially litigation. Once Maria, the employee, provides the requested reasonable documentation, then the agency has to work with her to reach a reasonable accommodation, as we've discussed before. that could mean a lot of things. It could mean providing extra PPE. It could mean limiting her contact with certain patient populations. It could be reassigning her to a different job temporarily. It could be bringing her into the office away from patients to do some other job function. When you get into the area of reasonable accommodation, the options become somewhat limitless, and it's important to sort of look at what all your different opportunities are. And keep in mind that the investigation authorities, the EEOC and the others that enforce these laws, their view of what is a reasonable accommodation in your view might not match up. And if you're going to take the position that something was an undue burden, you really need to be able to demonstrate why. Why is that an undue burden? Why could you not make her comfortable by providing extra PPE and adequately protect the patient population at the same time? Isn't that what you've been doing all along with potential COVID exposure? So something to keep in mind as we, let's go and look at the next slide. And Heidi, I think you've got one more scenario for us. Maybe
Sure.
a couple, actually.
Sure. Yeah, so this scenario, we have a physical therapist, and he objects to the mandatory vaccine requirement as well. And he just basically thinks that the COVID pandemic is vastly exaggerated. It's, you know, a liberal snowflake hoax. The disease is not worse than the flu for a healthy 42-year-old like him. And besides which, the vaccines are all fraudulent. So again, the question is, how do you address his objections? Next slide, please. So again, we're looking at, as Jennifer said, you know, the evaluation of the nature of his job. He's out, he's a PT, he's working with patients, so therefore a vaccine is probably definitely job related, and this is something you're going to want to put down in your documentation. Now, George hasn't specifically requested an exemption from the vaccine. Well, he kind of has, but really he doesn't make an individualized sort of request about the vaccine based on a physical disability or a specific religious limitation. He just sort of generally is a cranky dude and objects to all of this. So since he does not have a sincerely held religious belief, he can be required to receive the vaccine if you have a mandatory vaccine policy. And because he can be required to receive the vaccine and he doesn't have a religious objection or a physical limitation, a disability under the ADA, the agency doesn't need to work with him to reach a reasonable accommodation. So this is where you just have a difficult employee, an uncooperative employee. He doesn't have a good basis to object, and so you don't need to work with him. And if he continues to refuse to get a vaccine, in this particular circumstance, you might very well be able to terminate him for failure to get a mandatory vaccine. Note, may, because again, there may be other laws and other reasons why you can't terminate him, but at least in this very, very specific fact scenario about he objects to a vaccine because he's just a cranky dude, in that circumstance, you could probably terminate his employment with your agency. Next slide, please.
All right, final scenario. Yes,
Yep.
We're going to talk about a patient. So Mrs. Townsend is a patient of the agency, and she's very concerned about the COVID pandemic. She has numerous underlying medical conditions, and she wants to know if the nurse visiting her has been vaccinated against COVID. She states she will not let any unvaccinated personnel into her house. What should the agency's response be? Let's go to the next slide. So this is a pretty, I would say probably not something that's terribly uncommon, and it's certainly something you need to be prepared to address. Can we go to the next slide? Great, thank you. So first and foremost, we would encourage agencies to try to educate the Mrs. Townsends of the world about the status of vaccine availability in your particular geographic area and what you're doing to ensure relevant employees have been offered the vaccine. Obviously, today, vaccine availability is still it's very geographic specific and provider specific. Not everybody is going to have access right away. It could take some time to get your staff vaccinated, assuming you either go with the mandatory or the strongly encouraged vaccine policy. And patients need to be made aware that you're doing what you can, but not everybody can get vaccinated immediately. If Mrs. Townsend's regular nurse has requested an exemption from vaccination, either based on disability or on a sincerely held religious belief, whether that's, as we said, under ADA or Title VII, then you have to accommodate her RN unless it presents an undue burden. Since patient care is obviously our first concern, you should determine if you can accommodate Mrs. Townsend's request and substitute another RN for her regular RN who has an appropriate exemption, meaning she's either got a disability or a sincerely held religious belief. And again, this all presupposes you're mandating vaccination. You shouldn't tell Mrs. Townsend why the regular RN is not vaccinated. People who have disclosed to an employer that they have a disability or a sincerely held religious belief have privacy rights. You're not entitled to discuss those with anybody in the organization who doesn't have a need to know that information in order to accommodate the person's disability. You cannot tell patients. Your regular RN isn't coming because she's allergic to the vaccine or her religious beliefs prevent her from being vaccinated. You cannot share that information. If you reveal that the reason she's not seeing her regular RN is due to a medical exemption, you can properly disclose information under the ADA. So these are difficult scenarios. You want to ease patients' minds, you want to make their families comfortable, but at the same time, you have to protect employee privacy and sort of navigate all of the reasonable accommodation and undue burden requirements. So these are some guidelines that might help you navigate that, keeping in mind every situation is unique. Let's go to the next slide. Heidi?
Yep. All right. So closing in on the end, we did want to touch just on some privacy issues regarding vaccines. Again, we've given you sort of guidelines around these. One of the things to note that the ADA does require that an employee's medical information must be stored separately from the personnel records. Very important. ADA actually has done audits. EEOC has done audits on this. I have actually worked with entities who have had to defend an audit, and they do look at where is the medical information stored and how is it separated from the regular personnel records. And those are, hiring, firing, pay, that kind of thing. So how do you keep this information separate? Well, if you keep your records physically, then one of the best ways to do it is just put it in a separate folder. Segregate it from the rest of the information. If you have this information held electronically, you want separate documents for this information. And again, if you've got a good organization system electronically, put it in a separate folder on your share drive or your drives. Again, you just don't want to commingle these records. The other thing is that this information can only be disclosed to supervisors or managers who need to know about the work restrictions or limitations. So in the scenario where we had the employee who said she had an allergy to vaccines, it only needs to be disclosed to her immediate supervisor. You should not be disclosing this information to all the employees in the agency, and you should not be disclosing it even to other supervisors and managers, only those who need to know about the work restrictions and limitations. Sometimes sometimes medical information related to vaccines is going to implicate GINA, the Genetic Information Non-Discrimination Act. For example, if there's a family history of something that would cause somebody to be allergic or to object to a vaccine. So you need to be careful about GINA as well. And again, that also requires that genetic information be held separate from employment records. So Again, the same kind of thing, separate folders. If you're holding it physically, separate documents, separate sections on your drive if you're holding it electronically. Now, unlike the ADA, this information cannot be shared with supervisors and managers. If you share any family history or genetic predisposition or something like that, that is flat out a violation, and it doesn't matter who got that information. So you want to be careful about that. A lot of people are always concerned about HIPAA. I do want to say that HIPAA does not apply to you holding medical information in your role as an employer. So if you're trying to, again, figure out whether or not somebody has a disability and you want to evaluate whether or not a reasonable accommodation is appropriate, and you get, let's say, a physician's letter, that is not medical information. That falls under HIPAA because it's not for the purposes of treatment, payment, or operations, right? This is really for the purposes of evaluating compliance with ADA and Title VII. So in these kinds of circumstances, HIPAA does not apply. Just be aware, state laws might apply. Again, state privacy laws are a little bit different than federal laws, and we're not going to delve into those. It's beyond the scope of this. But generally speaking, HIPAA does not apply. All right, next slide, and we're closing in on the home stretch. So a couple of things about an employer's vaccine policy. So you should have a written policy. You do not want to be doing this verbally. Again, if you have a verbal policy, what's going to happen is people are going to say, oh, I was in the same situation as so-and-so, and you treated me differently. So you want to make sure your policy is written down, and you wanted to have a written policy now before you start doing these things. You don't want to be creating policies after the fact and then point to them. We really strongly do not recommend a blanket mandate for all the employees. As Jennifer mentioned, you know, different employees have different circumstances. So your vaccine requirements should be job related, addressing the business necessity or as justified by a direct threat. And again, you're going to need to do this on a job by job basis. That doesn't mean you have to look at everybody's job, but you can categorize it, you know, RNs, PT, OTAs, you know, office personnel, that kind of stuff. I will note that the EEOC has explicitly determined that COVID-19 is a direct threat, so you want to make sure that you actually include that language in your policy, that there has already been a determination made of direct threat. And that actually then takes care of one of the prongs of your analysis. You have to be prepared to address requests for reasonable accommodation if you mandate a vaccine. And this is, again, why we recommend that you strongly encourage but do not mandate vaccinations. You can require proof that the employee received a vaccination. And again, this can be something as simple as a receipt from the administering provider. Again, you don't want to have really detailed medical records. That's going to put you into a problem under the ADA or Title VII. You just want to be careful. Sort of think about what is the bare minimum proof of an employee receiving a vaccination. And again, as we have said repeatedly, we're going to sound like a broken record. You want to make sure that you keep good documentation. Last slide, please. So some of the keys to a successful implementation of a vaccine policy is repeatedly educate your employees about COVID, the vaccines, and your policy. I would presume that most home health and hospice personnel really have a pretty good understanding at this point, but you know, never assume, because it makes it out of you and me. And you want to be able to show that you have taken all the steps you need to upfront. So repeatedly educate your employees. If you do that via staff meetings, make sure you have minutes of your staff meetings. If you send out emails, that's fine. All you need to be doing is just making sure you educate your employees about the vaccines and the policies. Again, we recommend strongly encouraging the vaccination instead of mandating it if at all possible. If you're going to be open to hearing if you're going to mandate a vaccine, again, for particular job categories, you absolutely have to be open to hearing employees' requests for the reasonable accommodation and then document. The documentation is going to be what says you're behind if an employee complains and if you're investigated. Jennifer and I run into this over and over again. Providers have good rationales, good thoughts, but the actual documentation, frankly, is subpar, and that is what usually leads to big fines and paybacks. So you want to make sure your documentation is just stellar when it comes to these kinds of things. One of the things that I forgot to include with the documentation is we do have a sample voluntary vaccine policy. If you're interested in receiving that, please let us know. And actually, maybe I'll just send it to everybody that was on the call. Again, the policy is a baseline policy. You need to tailor it to your particular circumstances, meaning your locale, your employees, and the nature of your business. I guess we can be, we're over just a few minutes, but I can spend some time taking some questions, Hunter, if we have questions.
All right, let me see here. What do we do if we have caregivers whose sole responsibility is to care for the client and we cannot find them another position? I guess in terms of
not sure I understand that.
If we have caregivers whose sole responsibility is to care for the client when we cannot find them another position, I guess what would happen if they did not want, I guess, a vaccine? There's nothing else.
Well, again, it kind of depends. If the employee doesn't make an accommodation request, a request for a reasonable accommodation, then you can mandate that they be vaccinated. But if they make a request for a reasonable accommodation, then you still have to evaluate, are there other things that can be done? Probably the most common thing I would think in this circumstance is load up on the PPE, right? Double layer face shields, double layer masks, face shields, gowns, and so on. If that is their sole function, and you want to keep them on the job, that's probably the thing that I could do. It gets really tough when the job necessity is of dealing with patient care and there's really no way around it, right?
Right.
So this is why the documentation becomes so important, because you need to put in your job documentation that there is no other job available for them. They must provide patient care. Here are the individual skills and qualifications. This is why they can't be slotted into another job. So again, it comes down to documentation.
Well, I got a few more. What if clients/patients are insisting that attendants/employees get it? We are currently strongly recommending it, but we are not requiring it. How do we handle these clients or patients that are firmly requesting that our attendant/employee gets vaccinated?
I think we kind of addressed that in that one scenario. I mean, I think part of it is, documentation and education, that you may not have the vaccines available to you just quite yet. Again, the quantities that are out there in the community are not sufficient to vaccinate everybody. And in addition, Texas is vaccinating not just 1A healthcare workers, but they've opened up the vaccine dosages to 1B. As a matter of fact, the county that I'm in yesterday opened up a waiting list for people who are 1B, which is not healthcare workers, but individuals over 65 and people who are 16 or older plus have an underlying health condition.
Right.
So from the time that waiting list opened up yesterday about noon I'm up in Collin County, through about 4 p.m., there were like 29,000 signups. So.
And this is Jennifer. I mean, this is my perspective on this. You know, you want to try to educate the client. You want to educate them about availability of the vaccine, steps you're taking to mitigate their risk. Ultimately, if you can't come to, and you're not going to impose mandatory vaccination on your staff, if the patient refuses care, they refuse care, and you'd handle it like anybody else would refuse care.
We do have a few more questions, so try to keep the answers a little, I guess, shorter. But we have, like, for instance, someone asked, regarding scenario 5, can employees sign off on releasing vaccination status to patients? Is that something they can do?
Can employees sign off on releasing vaccination status?
Yes, to their, I guess, if a patient asks, like, have you been vaccinated, or have they, yeah.
You can, yes, I believe it is appropriate, and this is me speaking off the cuff, but I believe it's appropriate to confirm whether a staff member has been vaccinated or not. But you cannot tell them if they have not been vaccinated. You cannot tell them why.
Okay.
And that shouldn't be done. That shouldn't be done by just any employee. That should be, you know, this information shouldn't reside with everybody at the agency. This is information that should reside with the management staff that needs that information.
Do the COVID-19 test results, do they need to be filed separately from their personnel files?
Yes.
Yes, okay. And kind of a second question off that is, do they need to take a record of the vaccine, or is a verbal report okay?
That's up to the agency's policy, I believe.
Okay.
Yeah, I would probably recommend some written documentation because you know, what happens if, you know, somebody says they got a vaccine and then they didn't, and then they catch COVID, and now your agency becomes the node of a spreading event. So I think it's okay. I think it's verbal is okay. I think the preference is to have written documentation. And again, it doesn't need to be extensive. It can be just a receipt from a pharmacy showing that a vaccine was administered.
And then maybe one more. Does employees refer to contract staff as well?
There's actually a lot of Q&A in HHSC's FAQs on contractors as opposed to employees. And the reality is that in the COVID testing area, it's clear that the responsibility, let's say in nursing facilities, even if there's a contractor, the facility is still responsible for ensuring that the appropriate required testing has been conducted. I would likewise, you know, if your agency is going to implement mandatory vaccine and you use independent contractors, I would absolutely expect you're going to be holding, you know, through a contractual responsibility, everybody to the same standard.
Okay. Actually, I got one more.
And I would just, I would just say as well that not just independent contractors, but if you've got a staffing company that you're working with as well, again, that is something you're going to need to address at the staffing company level as well. And as Jennifer said, presumably that's covered in your contract, but you should probably go back and double check your contract to make sure.
I mean, generally, if the contract's drafted by somebody like me or Heidi, it's going to include some language that says you've got to comply with agency policies and procedures. Right. If you've implemented a mandatory vaccine policy, you need to be educating your independent contractors and staffing agencies and the others that you work with about what your policies and procedures are so that they can follow them.
All right. And that should be just about it. We got a lot of questions. One question is, will you be providing these slides? And the answer is yes, we will. One person also asked do you have of the sample policy, like a copy of it?
Yes, we'll send it out later on, along when you send the slides this afternoon.
Perfect. Yep. So,
to be clear, it's a voluntary vaccination policy, not a mandatory vaccination policy.
Okay.
Correct. Yep. Correct.
And that is 1 second. Oh, so someone wanted to clarify. Did you say we have to file the proof of vaccine separately?
Yes, I would keep that separate.
Okay. All right. That should be about it. The slides will be going out shortly, as well as this sample policy. And
I encourage anyone, this is Jennifer, if you have follow-up questions, feel free to contact either Heidi or me. I note my phone number on the question slide is actually wrong, but you can call our general office number, lylesparker.com. That number is on the website, and the emails are always available.
Yep. Anything from you, Heidi? Or
Nope, that's it.
right.
Just again, if there's questions, we're happy to answer them afterwards. We realize this was a very high overview and that we may not have answered everybody's specific questions.
Right. All right. Well, thank you, everyone, and thank you for TAC for sponsoring this, and we hope you have a wonderful rest of your week. Thank you so much.
Bye-bye.
Bye-bye.